right, this section is about secondary competitions in person with disability, but I gather that I won't have time to go through all the secondary competitions, so instead I'll tell you resources we have here or nationally, can be used to study the secondary health competition. So that's my focus today. So I'm going to tell you about the model system databases. These are, there's a 3 model system database in this country right now. So they basically is a prospective, longitudinal, multi-center study on the longitudinal course of catastrophic injury, and particularly focus on the outcomes after a coordinated system of care. That means that in acute trauma care and also the inpatient rehab. So these are federal funded projects. It's by NIDILRR, National Institute on Disability, Independent Living and Rehabilitation Research. NIDILRR is under the Administration for Community Living and Department of Health and Human Services. The nicely is that these data are all widely available on the website. You can go and download. So I hope you can take advantage of this available data set. All right, so as I said, this is 3. So the first one is Spinal Cord Injury Model System Database, started in 1970. Traumatic Brain Injury Model System Program, and database, started in 1987, and the burn model system started more recently, it's 1994. So these 3 programs run about the same mechanism, at least currently. They are kind of 5-year funding cycle. So for the spinal cord injury model system, the current 5-year cycle is 2021 to 2026. They funded 18 centers doing initial enrollment, also follow-up, and we also have 5 follow-up centers. And among these 18 centers, there is 1 national data and statistical center. It's currently located at UAB. And then for TBI, their cycle is a little bit 1 year off of the SCI, which is 2022 to 2027, currently have 16 centers plus 3 follow-up centers. And the National Data and Statistics Center is located in Quake Hospital in Denver, Colorado. Burn is much smaller. They only have 4 centers, and the Data and Statistics Center is in the University of Washington. So in addition to the 3 program and data center, there is 1 model system knowledge translation center, MSKTC. So all the 3 model system program database had to work with the KT center to help disseminate and translate the knowledge they learned. So that's how the model system operated. So a little bit more detail about the scheme and TBI. They are, similar structure, and you can see scheme started in 1970. TBI started in 1987, that's the distribution they have, across those funding year. And just a little bit why this model system is so important, definitely for research, for clinical care, and also for the rehab facility. They are very significant as well. It's one of the metrics when you try to rank the U.S. News and World Report about best rehab hospital, that take weight, they take score points if you are the model system center, one of the model system center. And also recently CMS, Center for Medicare and Medicaid Services, have a new rehab innovation center designated. So the model system is one of the criteria as well. So very nicely at UAB, we have 3 model system center here. We got a scheme since the very beginning, 1972, continuously funded until today. We have National SCI Statistical Center, continued funded since 1983, and we also have TBI Model System Center in-house. So definitely students here, researcher here, trainee here, please take advantage of the nice resources we have in-house. So a little bit more detail about what's included in the database, what's the structure. I'll use the spinal cord injury as an example because that's my area of research. So for the database, it's very similar for TBI as well and for burn as well. We always have data collected at the initial hospital care. We call it Form 1 data set, and also we follow them up over time. We call it Form 2 data set. For HCI right now, the follow-up schedule is 1 year, 5 years, and AV 5 years, continue until the patient say no, until the participant withdraw or pass away or recover from the disease. That's the current data sample size for the scheme. So that's just about 2 weeks ago. So in the Form 1, in the new injury, we already have more than 38,000 enrolled in the database. The injury date going back to 1972 until today because we are continuing enroll them. And in terms of follow-up, it's more than 136,000 usable data for the follow-up research. The longest follow-up is 50 years after injury. We have about 31 record, 50 years after injury. We have more than 400 record at 45 years post-injury. And then the right side is their current status. As you can imagine, more than 1/3 of them already passed away. Some recover, some withdraw, so it's not eligible follow-up. But we do have about 50% that still continues, in the follow-up. We try to get their information. And the database continues to grow. As I mentioned, we are current 5-year cycle until end of 2026. And we 18 center, 5 Form 2 center. Our growth rate is about 800 new spinal cord injury, traumatic spinal cord injury enrolled in the database every year. And we probably gain about 2,300 follow-up record every year. So the database is continuing to grow. So what included in the database? I want to emphasize this is a funded project. We have designated person, trained personnel to collect the data. This is not just medical record or administrative data set. This is a research-based database. So because of that, we need resources, and because the constraint with resources, we cannot collect every piece of information we want. But we try to map out the ICF model covering health condition unique to this population, body function structure, activity, participation, but also some contextual factor as well, right? Not just look at income, outcome. We want to know what's the driver of that best outcome or worst outcome. So we have environmental factors here. We collect that, and also have personal factors there. So the data came from medical record. A lot of time that's the initial hospital care. We have direct exam. But most of our record is collected from patient or participant. So report, definitely one, we want to hear from them. 2 is just relatively easier than ask them coming back to do a lot of tests, a lot of exam. Also, we link to the death record, National Death Index, to get their, to understand their survival, to know their cause of death. And again, this is research-based and trained personnel, but we also have standard operating procedure. We've done a lot of quality check. We do certification, and we do monitoring, we do report, and then we meet regularly to improve the quality of the data and improve the utility of the data. So if you go to the website, uab.edu/MSCISC, you can get a lot of information about the database, and on the landing page, there's a place you can go and download the data. And right now, we put out 2 versions of the national data set for download for HCI. So these are based on the end of last cycle, for example, version 2021. Annual report version. These are going back from the beginning up to September 2021. All the data are there. We also have previous cycle version. The reason we put out 2 versions is because the database did evolve over time, right? We may get rid of some information because we feel that's not relevant anymore, and we may add new information. For example, internet access, who think about that question, 20 years ago. So we do kind of evolving over time. That's we put out different version because some information may be in the old data set, not in the new. So there's a dictionary on the website, data collection form. We also list all the publication, so you can see how the database has been used. Have my question been answered before, so they all can help you. I did not put here is that we also have consumer fact sheets, or for professional or facts and figures, just one page to give you a quick glance of the facts and figure of this population. So my last 5 minutes, I'll run you through how the data have been used to address the secondary health conditions. So this is an article published in Archives of Physical Medicine and Rehab in 2022. So basically, as I say, you probably heard this changing demographic of traumatic spinal cord injury. We see more and more elderly, have spinal cord injury. That's changed. And then and then we'll see what that impact people living with spinal cord injury currently. What's the demographic? How are they doing? So that can help to make sure we have a healthcare system to meet their needs, and also we can project for the future. So that's the purpose of this study. So data set number one is we just, pull the data out. We look at people who could be injured a long time ago, could be injured just yesterday, enrolled in the database, but they are currently alive, just people currently living with spinal cord injury. Could be 30 years or living, could be just a month living. So we want to know the demographic and know their health status. And the data set number two is that during that study period, we have about more than 50% of them come back for the follow-up. So we have more detailed information about them. Then we want to make these two data sets more representative. We do a little bit statistical weight to make sure representations. And that's the information we can see, right? We can study their demographic. We will know their injury characteristic, their participation, also their health status. These are the information available in the database we can use to study their health profile. So I'll quickly go through 5 key findings I feel important. One is aging of the traumatic SCI population. So the current age, when you go out, you meet people with spinal cord injury, they are average about 52 years old. So we did a similar study in 2008, so you can see it's aging, right? You can see people may die, new injury come in, what kind of balance you see there, what kind of pool you see there. You did see people, this population aging. And we compare with Canada data, Australia data, Sweden data, we are about the same. But definitely VA population is a little bit older, which is understandable. So that's kind of as expected, given we see now the SCI happen in elderly as well, and people live longer, so definitely the population is getting older. Second is education and employment, right? So we look at education, we compare with our general population. You can see it's about 30% of them have college degree, or even higher, similar between traumatic SCI and general. But you look at the employment rate, it's much lower. 26 versus 60%, it's lower than the Western Europe as well. So why? So it's a challenge, but also it's opportunity. I know Linda just mentioned about, people may lose benefit if they go out to work. So how we make the more incentive for working, inclusive labor market, vocational rehab. These are the things we can work on, and because we all agree that how important education and employment is in terms of our health and the psychosocial. So this is a little bit more health now. We divided them into 4 neurological severity group. On the left is more severe, on the right is relatively functional, motor, incomplete injury. And most of the health issues like urinary tract infection, pressure sore, rehospitalization, or stay in nursing home definitely is more prominent, more prevalent in the more severe injury. So those are numbers you can kind of see how common is this issue. But also some health issue is more common in the last least severe group, for example, alcohol use, depression, pain. So something we can kind of see why, what's the driver for that. In terms of advanced age, regardless how long you have injury, regardless that your age definitely play a factor regarding your health, including diabetes, and cell-person health. But definitely alcohol use disorder is more common in the younger group. But for people who survive a long time, they typically are doing well. But be mindful, this is a cross-sectional study. This is not we follow a person over time. But overall, it's a survival effect, right? If you live longer, then. So overall, I just summarize there's a lot of good thing about the database, but we also need to keep in mind about the limitation database when you do a study on this. But overall, it's valuable resource, relevant, and trusted resources. And I just plug in, CEDAR still call for pilot project. You still get 1 week to go. If you are interested, I'm happy to talk to you to get the pilot grant. Thank you very much.
Thank you, Dr. Chen.